are about to go live. Continue. Starting event. You should be live now, Chairman.
Thank you, Simon, and thank you everybody who is tuned in to the meeting of the local Outbreak Engagement Board, which has been delayed to some technical difficulties, and I thank our officers for resolving those, and we're now able to move forward. So this is our meeting on Thursday, December the 10th, 2020, and we'll start with the agenda item number 1, which is the minutes. We are to confirm as a true record the minutes of the meeting held on the 12th of November 2020, and I just look to the board to indicate their agreement with that.
Yeah, agreed.
Thank you very much. They'll be recorded. Item 2 is declarations of interest, where I invite any members of the board to declare any interest they might have in relation to matters on the agenda, which they have not previously disclosed as part of their council declaration of interest. Have we any new ones? No.
None from me, Chairman. No.
Thank you very much. Item 3 is public question time, normally 15 minutes. I'm not aware that we've had any questions delivered in writing prior to 2 p.m. on Tuesday the 8th of December, which is the deadline, and therefore there are no questions to be dealt with as such today. So I'll move on then to the key reports, and straight away I'll turn to our colleague from the Director of Public Health, Simon Bryant, and ask him if he would present to us his update and actions that follow. So that's items A and B in item 4.
Yep.
Thank you, Simon. And we've got a picture of the PowerPoint as well.
Update. Yep.
Many thanks, Leader. I will go through this PowerPoint presentation that gives you some information on the current state of the virus for the Isle of Wight. And then we'll take a pause, and then I can update you on some of the latest interventions.
Thank you.
So the government produced its winter plan, primarily based on the 5 indicators to show where we are going with the virus. And the indicators are the case detection rate in all groups, the case detection rate in over 60s, and whether it's rising or falling, because obviously that's really key, the positivity rate and the pressure on the NHS. So I'll go through those indicators and a few other bits of information this afternoon, so that we can have a full picture of what's going on in the island. And you can see from this map straight away the restrictions and the different tiers around the around the country. With regard to the southeast, the key areas are Kent and Medway and Slough, and those are the small red areas, and then Bristol over here. But I've got a more detailed map of that. We can see here on the left hand side of this slide week 47 where we had some areas, more areas red, and if you look on the right hand side you can see the infection rate is coming down across the country as a result of the national lockdown and key measures. I think that's really encouraging. The Isle of Wight has itself, you can see week 47 it was in the middle bracket of 50 to 99, it's come right down to now being in the lower bracket of 0 to 34 cases, which is really encouraging, and really thanks to everything that everyone's doing, both the population, professionals, the NHS, all of us together are really key, and this outbreak board is a key part of that. So I think that shows an encouraging picture. I think it also shows us to be really mindful that we all followed, and we were all in the same national lockdown, and some places the rates didn't fall. The Isle of Wight was in a really positive position to start with, but we've seen in places of Kent, Medway, and parts of London where those rates didn't go down, they went the opposite direction. So let's not be complacent, let's continue the really good work we're doing, but I think it really shows the picture of the country. And the picture just quickly of the southeast, you've got the R number here, with southeast being 0.9 to 1.1, and you can see the areas of Kent which are have many more cases, and then you can see Slough and a few areas in Surrey and parts of London. So just to kind of give that southeast picture, which is really important when we think about our hospital capacity. Now, whilst the island is an island and has its own hospital, if we were needing to work as a system more significantly, but we know the pressure on the Kent hospitals putting pressure on the Surrey and Sussex hospitals, that's then bringing pressure onto the Hampshire hospitals. So it's just really important just to bear that in mind, the bigger picture. So the 7-day rates here are something we look at. So in England, we've got 151, Southeast 156. So this is the rate of the last 7 days. And the Isle of Wight and Southampton are the only ones in the last 2 days that have come down. So we've seen a real plateauing of those rates coming down. Previously, they were all coming down. But as I say, the Isle of Wight's in a really good position with a rate of 16.2 and 23 cases in the last 7 days. And you can see that in the graph on the right-hand side. The light blue being the whole population, and the dark blue, as you've heard me say previously, rates in over 60 are really important because we know those people are more likely to be impacted more by the impact of COVID. So that's really encouraging, but less encouraging picture on the wider geography. When thinking about the tiers, as I talked to you about, these are the ones that the government looks at to see which tier each different area will fall into. So we can see our direction of travel is down for both our case rate and our case rate in over 60s, and our positivity is also under 5, which is something we really want to see, which is great. But we can see and there's a slowing down of the number of new cases, which is really positive. The pressure on the NHS is obviously it's not an absolute measure, but it's currently low on the Isle of Wight. But for our neighbouring areas across the water, there are more pressures in the NHS. So when you do some area comparison, this is a couple of days old, but you can actually, it's really helpful just to see in terms of how that pandemic has spread over the last few months. And you can see Portsmouth at the top there, followed by Southampton, Hampshire underneath, oh, pardon me, I'll go back. Hampshire there, and the Isle of Wight right at the bottom, which is really, really positive. Again, a really good picture for the Isle of Wight. And then we look at our case rate by age group. This is a slightly enlarged graph of what I showed previously, but you can see the difference there between the under 60s and the over 60s, which is again showing a positive picture. Just to bear in mind, in the first wave here, on the left-hand side, we had a different testing regime. So we weren't testing all cases, so we can see we've had a really good position. And then infections as of the 9th of December, again, you can see the cases on a daily basis. These last ones are not validated yet, it takes a little bit of time to get those logged, but again, you can see that positive picture of the rates coming down. Total number of cases on the Isle of Wight since the beginning of the pandemic is 998. And then really important to think about our deaths. Sadly, we are seeing deaths from COVID. Total number of deaths to date is 98. The dark blue ones are where COVID is mentioned on the death certificate, and the light blue ones are where COVID is not mentioned. And equally, you've got the line of the 5-year average deaths, and that will be something we just need to think about. So we're just roughly in line with that. So the average for the 5 years. So back in October, we saw increased number of excess deaths, so more deaths than we were expecting. And here we are in line with that. So in summary, it's just a decrease in COVID activity, and that's great. And infections, whilst levelling off, hospitalisations and deaths may continue to rise following that peak, but we're in a good position. We know it has significant impact on health, economy and society. I think the one I really want to think about, and apologies, I've just realised I've left Hampshire in there, my apologies, for the Hampshire and Isle of Wight, please take that. The forthcoming Christmas bubble, we need to be really aware of that, and the likelihood that with more people mixing indoors, that we are likely to see an increase of cases going up due to the way people are mixing. Councillor Stewart, I'll stop sharing there, and very happy as always to take any questions. You're muted, Councillor Stewart.
Yes, I've got a couple of questions, and then I'll pass around to the rest of the board. One that falls out of the very last paragraph in your slide, actually. So correct me if I'm wrong, that for Christmas, up to 3 households can form a bubble. Once they do that, they have to remain in that bubble and shouldn't mix with others inside. If they don't choose to form a bubble, they've got to follow the tier rules, in our case, tier 1, which means they can mix with up to 6 other people in their household. and they only way they can mix with beyond that, and indeed in the bubbles, is people have to be outside in a public space. That's good. That's just clarification. First thing I wanted to have written down is what a positive position all the work that everybody across this island has put into doing what we've asked and actually playing safe, looking after the vulnerable, is evidence itself in what you've described there. With, I mean, 16 per 100,000 is a really low rate, and that was I didn't know that. And also, I think that even areas like Southampton are now down to 66. I have two questions. One, I see Portsmouth is still up at 141, which will concern some people because people from Portsmouth come to the island as they do, key workers or whatever. And the other one on the sad death rates, do we have any sort of demographic picture? So 98 people have died, but is there any indication of what levels, or maybe we can't disclose that? I don't know.
Yes, let me come back on your first point about the rule of six and the bubbles. It's worth reminding people that when they meet in a rule of six, you should still make sure there's the hands, face, space
Social
message.
distance. Yep.
Whereas where you're in a bubble, you can sit around the table as you would like a family, which is really important to remember the difference there.
Thank you.
With regard to Portsmouth, you're right, it has crept up. There has been particular situations in Portsmouth around school-based settings, which they've seen outbreaks that they're dealing with. We do look very closely at that because you're right. Obviously, there is commuters from Portsmouth to other areas, so we need to keep an eye on that factor. So we are aligned with that. But yeah, we've seen it increasing that younger population. And with regards to deaths, obviously they're very small numbers each week. We do look at that, and as I said, it's mainly in that older population
Right.
of the population.
Thank you. I'll pass now to other board members. If you just indicate, in fact, I'll go around. We're not a large board. Gary, did you have any questions?
No, thank you, Chair. Nothing from me at this stage. I think Simon, it's been thoroughly explained by Simon, so thank you very much for that, Simon.
Yeah, very clear. Claire, did you have any questions?
I'm fine. As the cabinet member, I speak to Simon on a regular basis as it is. Thank you.
Thank you for that. Stuart, did you have any comments or questions?
One query, which is to do with the overall levels of infection and the total number of deaths. Are we seeing a decreasing trend in the number of deaths as a percentage as a result of the better handle we've now got on how to treat people? I'm hoping that you're going to suggest that most of those deaths occurred in the early days, i.e. a higher percentage of deaths per 1,000 population at the beginning of this pandemic, and now with the same number of people being treated, a smaller number of deaths. In other words, the likelihood of survival is improving. I hope. I wait to hear your comment. You're muted, Simon.
Many apologies, my error. At the beginning of the pandemic, we did see more deaths. That's partly of the proportion of the cases. Be careful because we were recording that differently, but you're right, we saw that. In this second wave, we saw more infections in a younger population, and that's why we're worried that if it started spreading to the older population, we would see more deaths. But at the same time, you're absolutely right. We've understood the disease better. We've got more treatments, so actually people's recovery is better. That doesn't mean it's not a risk. We also know, and it's been really encouraging to see in the last week, our infection rates coming down, but we know that the deaths are a lagged data from that. So we are likely to see more deaths in the next couple of weeks, sadly, because of the lag of infections. But you're right, we've got better treatments, so it should be a better picture than the first wave.
And a supplementary, if I may, Chairman. When we spoke recently, Simon, we touched upon the number of people who had survived the virus but were left with long COVID. In other words, for many months yet they are likely to require help and treatment. And I know you were saying that because it is early days, we were looking to put some statistics together to see what percentage had this continuing awful long COVID. And I'm wondering if you could give us any sort of indication, and I appreciate it may be weeks away, as to when we might have some information as to how many people continue to suffer.
You're right, and I think the name kind of gives it away. Really, it's kind of long COVID, so you have to wait for people to know they haven't recovered from COVID. We are looking at that, and we are also, the NHS is really a key part of that, to make sure they've got the right appropriate assessment and treatment in place, because we know it's affecting lungs and possibly hearts. So we are looking at that. You're right. I think as we've kind of followed the first wave of the pandemic, we're seeing those kind of people with long COVID coming forward. Obviously, it's not a clear set of symptoms, so actually we need to really understand that, and you know, whether it's heart, lungs or other things, you know, exhaustion, you know, may fit kind of the glandular fever type symptoms. So there's a number of things we need to factor in, but you're absolutely right. It's something that I would recommend that the Health and Wellbeing Board picks up as a kind of ongoing statutory body in the long term, to really understand that and make sure that as an island we can support those people in the right way.
Yeah.
Thank you.
Okay.
Thank you, Simon. Can I ask you one question that probably links into two, really? Looking ahead, I suspect the question on a lot of people's minds will be, how is the vaccination programme, particularly for the island, looking? And also linked to that, I suspect you will want to update us on the test and trace situation. Yeah. If you could do that, that would be helpful.
So if I move it, that's kind of the second item on the agenda, and I think absolutely, if we pick up on the vaccination, it's absolutely fantastic news that we've got a vaccination in the way that's developed. Before I go on to the really good news, we need to be really mindful it won't affect what's going on now, because it will take time for the population to get immunised and for immunity to take place.
Yeah.
In that context, it's very good news. So it really will help us for the springtime. The vaccination programme is led by the NHS. We've had the first vaccine approved by the MHRA, who look at the safety figures, and that's very good news. Very logistically challenging, because the vaccine that has been approved needs to be stored at -70. And I was listening to a GP last night. You need to kind of shake it, but then if you shake it too much, it all mixes up. So we're really careful with this vaccine and how it's delivered, which is why it's quite a complex vaccine programme. We've seen the first vaccination programme delivered. I think it was in the Midland, wasn't it? Maggie was the first one we saw on the news, and that's fantastic. We know people require 2 doses. We also need to remember, when delivering this, people still need to social distance and all those kind of things. So that's great. We'll begin to see the vaccination roll out much further from the Portsmouth hub next week across Hampshire and Isle of Wight, in various settings, with more sites coming on board fairly quickly in the next few days and weeks. The comms plan is an NHS comms plan, so we're supporting that really carefully to make sure that our population can get that as quickly as possible, and that will really help us, because once we have vaccination and we have more people immune, actually it will help the whole population. But I'd encourage everybody when they're offered the vaccination to take that opportunity to go and get that vaccine to protect themselves from this virus. As Councillor Hutchins said, you know, some people end up with some quite long COVID conditions, which are, you know, it's not just a short illness. For some people, it's quite a serious condition. As we've seen, some people are dying.
Thank you. I'm sorry. Yep.
Shall I carry on with track and trace?
Well, just, I know Mr. Metcalf, who's also on the call, may have a question. I was just going to check it wasn't in relation to the vaccine. If not, he'll probably wait until you've done check and trace.
Okay, Lee, I did just want to add a comment about the vaccine, really, because I think, I mean, obviously the terms of the board are about containment. So it's our outbreak engagement board. So it's about how we contain and make sure that we don't spread, or the virus is not allowed to spread. And I think one of the things that is really important for us to continue focusing on as a board and as a community is the very fact that it's going to take a while for the vaccine to roll out and a while for us to see the benefits of that. So we still have a very strong need for us to manage the virus, manage how we behave, and all the things that go with that. As Mr. Bryant has alluded to, the rollout of the vaccine has very much been led by NHS colleagues, and I know that they are still developing plans as they get greater clarity about how much vaccine is going to be available and when, and I think it's important that we engage with that. But I think the one thing, just to reinforce Simon's message, really is that we can't afford to let our foot off the accelerator, if you like, in terms of how much control we've got on the virus at the moment, because it hasn't all gone away just because we've got a vaccine and we're starting to roll it out. We've still got that responsibility to each other and responsibility to the island to do all the right things and make the right choices. So I just felt it was important to reinforce that point, Leader. So thank you for the opportunity.
Yeah, I think absolutely right, John. I think the message that we've been pushing hard for the island to do exactly what you've said. And the proof of the pudding is in the eating, because the figures that Simon's been able to give us today show that if people do what we ask, everybody stays safe. And therefore, I'll be very surprised if we change from tier 1 on the 16th of December, because everything is indicating we've done the right things. But of course, as Simon also pointed out, we've got this Christmas bubble situation coming up. And even though you could do lots of things within the bubble, I like the phrase, do what you should rather than what you could. Because the more you can do to do little things like keeping the windows open, make sure you wash things down, all those little things will help keep our infection levels down, so that we stay in that tier 1 after Christmas as well. And then we can more comfortably look forward to the vaccine coming in and taking place. So I think you make an extremely important message. It's nice to have evidence to show what we said is working. So Simon, do you want to go on to the track and trace, if I've said that right?
Yes, test and trace has been set up. We've got some, the testing centre at New Close is working really well, and that's got the right capacity to test our population. We're also seeing new modalities of testing coming on board, and we're working with government to ensure that for the island we can get those rolled out. So you'll have heard about lateral flow tests and salivary tests. So we're working on both those programmes. They're both pilot programmes in the sense that we're kind of making sure we've got the logistics right for that, so they're not quite as simple to roll us out as the impression's given, but we're working hard to make sure we can do that. With regard to the test and trace programme, so that's bringing down the local contact tracing from the national CTAS. What we've seen with the drop in number of cases is actually the national service is able to cope better, which is really good. So actually their uptake is about 85% now, which is really positive, but 85% really quickly. So we're able to enhance that with our local contact tracing service, which we started in a small area of the island, which will roll out. We've asked to roll that to the whole of the island, and we'll see that taken over from the island, working nationally with the contact tracing service to make sure all that knits together really well. Yeah. The advantage of the local contact tracing is not only it's phoned from a local Isle of Wight number, but we can ask those welfare questions if someone needs to isolate, which actually might prohibit them from isolating. That might be a caring need, that might be a pharmacy need, or something else that they just need some support with. And as the Isle of Wight Council, we can provide that support through our relevant vulnerable people cells. So that's really encouraging. So really pleased that that's set up and that's going well.
Thank you, Simon. And I think that's important as well, because it all forms part for me of the jigsaw of making the island stay safe till we can break away from this nightmare. So I'm looking at the agenda and I'm ready to move on to communication activities, unless there's anything else I've missed. No, so I'm now going to call our Assistant Chief Executive and Chief Strategy Officer, love that title, to give us an update on the comms.
Thank you, Leader. I mean, we've talked a lot about the messages already this morning, and we've put in place a comms plan and a message plan that will run through from now until the 4th of January, with those messages split into internal messages for our staff and external messages which are aimed at the general public, our stakeholders, and some sector specific advice through our regulatory services or our other service related areas. We've talked a lot this morning already about what our overarching messages are, so that what we should be doing and how we should be doing it. So as ever with tier 1, The big thing about being in tier 1 and staying in tier 1 is it's down to each of us as individuals to take responsibility, to choose to do the right thing, and the message of hands, face, space, and now ventilate as well when you're indoors is a critical message, and will continue to underpin our messaging throughout Christmas and into the new year. The other message that we've picked up, because I think there's some confusion about it, is in relation to the rule of 6, which Mr. Bryant has already mentioned this morning, that if you are applying the rule of 6, if you're meeting with 6 other people indoors, if they're not in your household or support bubble, you still have to socially distance and wash your hands thoroughly and regularly. It's not, the rule of 6 is not the same as a support bubble. You are meeting 6 different individuals, and the hands, face, space message needs to be combined with that rule of 6 message. So we're going to pick that up, and that will be pushed from now on through until the new year as well. Of course, the other really important message in terms of our generic messaging is around, if you have symptoms, you must self-isolate, book yourself a test, and then take part in tracing, which of course is even more important now that we have local tracing, and we can do all the good, supportive, additional added value through the local tracing programme that doesn't happen through the national programme, which is a really positive thing locally for us. And then I think the other element of the message, and again we've talked about this morning, is why we need to do all of those things. So we need to continue to work together to keep the island safe, and we all have our role to play. We've got our tier 1 status that will be reviewed every 2 weeks. We've had a good discussion this morning about how all the indications are that we're really heading in the right direction to remain in tier 2, but now is not tier 1. Now is not the time to let our guard down. And if we all do continue to make the really good choices that we have been making and do the positive behaviours, then we can sustain that tier 1 status throughout Christmas, and hopefully throughout the Christmas bubble period and into the new year. And 2021 can start more positively than 2020 is potentially finishing. So it is about, let's continue to make good choices. We don't want to be in the position of getting to January and looking back and wondering if we could have done more. But we do accept that actually Christmas is a really important time for families and friends, and people will want to meet families and friends, and they will want to mix. What we're saying to people is, you can do that, you can form Christmas bubbles, but please remember that those behaviours of hands, face, space should be our everyday norm now, and we should be thinking about doing them as a matter of course. We're also actively using the insights that we're getting feedback from on the ground with our COVID support officers or officers that are working operationally on the front line, and feedback from the sorts of questions and queries that we're receiving to make sure that we pick up any issues or confusion around Christmas bubbles, around hands, face, space, and then tweaking our messages accordingly. And then in the run up to Christmas and into New Year, we'll be following 4 key themes in all of our messages. A lot about shopping safely, the Christmas bubbles, how to work through the Christmas bubble guidance, thinking about going out and what that means, and some good advice about, our venues are small, they are capacity reduced because they are operating in a COVID secure way. So thinking about booking a table before you go is really important. Thinking about the end of the night and getting home is really important. And probably a really important message for everyone is, yes, please do go out and do have fun, but remember to please drink responsibly as well. And then the other message that we're obviously continuing with is that one in relation to visitors, and in particularly tier 2 visitors to the island, respecting the fact that we are a tier 1 area, remembering that you bring your tier 2 behaviours with you, and that, if you are going to come over, then by all means enjoy yourself, but enjoy yourself in a really COVID secure way. And then on top of that, of course, any new guidance that comes out from national government or national comms, and anything new that emerges in relation to vaccination or testing programmes will all feed into our communications and engagement work as well. Thank you.
No, thank you. Very, very comprehensive. And another, for those that are listening, another tip for me is very easy to get your app and clock into the premises using the QR code. And in some ways, it's a safety thing because you clock in, you're there. If there is a problem, if somebody has been in there and they need to contact you, they can do so. I've used it many times now. And it also shows people that you're actually thinking about COVID as you socialize and taking all the right steps. So I would encourage anybody who hadn't downloaded the app to download it still. Those that have, to use the QR code, which is in most of our establishments now for hospitality. And all these little things add up to what is, I think, a really positive position. Here we are, just coming up to Christmas, and we've got ourselves in a good place. And if everybody, including our visitors, can comply with what we've asked, then we should all have a good Christmas and maybe look forward to a more positive 2021, if that's the right phrase, as you said. So I think we've had a very positive update from the Assistant Chief Executive and Chief Strategy Officer. And then we'll just move around if any members got any questions.
Not a question, just a comment, Chairman. We've talked about the app and we've talked about technology, and we do know that technology can sometimes have glitches, as we found right at the beginning of this meeting. But also we do need to be aware that we have to use other means of communication to pass the message around for some folks, because elderly people, some may not have smartphones, some may have smartphones that they've had for several years, which are not capable of downloading the app.
Correct.
So I think we have to be mindful of using all the means at our disposal to get the messages across. And I know our communication teams have been working hard on that. So just a reminder there, really.
Yeah, I think that's really relevant. And if there are any media listening, I'm sure they will pick up on that because there are many forms we can use. Okay, well, on that basis, I think we've reached the end of the meeting. So I will thank all members of the board for attending today. Thank you, particularly our Director of Public Health, for his usual comprehensive and inspiring presentation. And we'll resume the other things we have to do today. So thank you very much, and thank you to the audience. Thank you.
Thank you, Chairman.
Thank you.
Thank you, Chair.
Bye.
Bye-bye.
Thank you, Chair.